Welcome, and thank you for tuning in to A Sound Constitution on CHLY 101.7 FM radio. We are your third-year Bachelor of Science in Nursing students, Karla, Kelly, Harris, Max, Sam, and myself, Cassandra. We're all studying here at Vancouver Island University in Nanaimo. We're working to open up conversations around community health, as well as demystify health issues affecting our community and the individuals in it today. The information and healthcare topics we at A Sound Constitution are discussing, they're all evidence-based, current, and acquired from trusted resources. Now, as a reminder, these discussions and topics are all for educational purposes only and do not replace the advice of your primary healthcare provider. If you have any questions, comments, or concerns, or have a health-related topic you want to hear on the show, reach out to us. We want to hear from you. Post a comment on A Sound Constitution's Facebook, Instagram, or YouTube pages and check us out. This is a great opportunity for us to learn, grow, and build resiliency together as a community and as an individual. Before I dive into the next episode, we would like to first start off our show by acknowledging that we are on the unceded territory of the Nanaimo people, with a broadcasting range that overlaps the Kuwatsun and the Sliaman territories. This acknowledgement is done with gratitude to the Nanaimo people and with the intention to increase awareness about truth and reconciliation processes and efforts being done on Vancouver Island. Additional information and resources surrounding Nanaimo history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. Thank you for tuning in to another episode with the Sound Constitution team here on CHLY 101.7 FM radio. My name's Cassandra, your host for today, alongside with Karla, your co-host. We are your third-year BSN Nursing student CHLY radio show host for today. In this episode, we want to begin unpacking a very real reality of systemic racism and discrimination First Nations people have faced and are still facing throughout our communities on Vancouver Island, as well as across Canada today. We hope to accomplish this by opening up these hard conversations and start taking action against the inequities First Nations people are still facing every day, right here on our front doorsteps. This is a conversation we all need to start having and having more often. It is each one of our responsibilities as individuals to stand up to discrimination and racism in our societies. We have no room for it here or anywhere. And it all starts with one conversation. I am extremely thankful and excited to introduce today's guest, Michelle Prince, who is here today to collaborate with myself and the Sound Constitution team on how to start having these conversations and how to start taking a stand against systemic racism and discrimination present in our communities, societies, and country today. Michelle is a registered nurse working as a community health practice consultant for the First Nations Health Authority up and down Vancouver Island. Her current role is to support nurses' professional practice through education, resources, policies, and guidelines. We are very lucky to have you and your expertise here on our show today, Michelle. And before we start, I want to express my gratitude for taking the time to help us implement various tools to start opening up these conversations right here on CHLY 101.7 FM radio. I think without further ado, let's dive right into this interview. Okay, so we have Michelle Prince here. To start off, Michelle, I just want to say Haichka, which means thank you in Halkaminam, for coming onto our show with the Sound Constitution at CHLY 101.7 FM radio. So if you want to introduce yourself, Michelle.
Hi, I just want to say Namakwa. It's thank you, and you're welcome. Thank you. I'm very glad to be here tonight. I appreciate the invitation and looking forward to a great conversation.
Yeah. I guess maybe just to get started, can you tell the listeners a little bit about yourself and maybe what led you to become a registered nurse?
Okay, my name's Michelle Prince. I am Sekani carrier on my mother's side from northern BC, the Mukau Lake area. I am also French Canadian on my father's side from Quebec, first generation from France, and happy to be here. I currently work as a community health practice consultant with First Nations Health Authority. for the Vancouver Island region. I've been doing that for a few years now. And I've been a registered nurse since 2011.
And I understand, too, you graduated from Vancouver Island University, didn't you? Is that right?
Yeah, that's right. I was part of the class that went through the transition from Malaspina to VIU.
Oh, that must have been an interesting transition.
It was.
Oh, that's great. And so where did you grow up? Did you grow up here on the island, or...?
Yeah, I've been a resident of Vancouver Island since I was 6 years old. My dad was a faller for North Island, and we kind of traveled from, a small remote town of Wass Lake. I don't know if any of you know where that is. Mm-hmm. And then now down to Nanaimo, and I think this is where I'm going to call home for many, many years to come.
Oh, that's great. Yeah, we're very lucky where we live here in Nanaimo. So... working with the First Nations Health Authority, what areas of work on the island? Are you working up and down the island, or is there a few communities that you work within?
My role is to support nurses who work in health centers in First Nations communities. And the areas that I work in, I work with 3 other practice consultants, and my area is the Central Region. So I stretch from Qualicum down to Lake Cowichan and all of the West Coast. So New Channel Tribal Council communities, NTC. It's a great area, and I work with some fantastic nurses.
Yeah, that's amazing. A lot of collaboration, I bet.
Oh, absolutely. Yeah. It's a big part of the work.
Yeah, it's really amazing, too, being really grassroots, growing up on the island, and now you're working within communities as a registered nurse. I think that's pretty amazing.
Yeah, I would have never guessed this in a million years.
Yeah. I guess going into what you do is for your work within the communities, can you maybe dive into a little bit more of like what your roles and responsibilities are and what you do in collaboration with nurses in the communities?
Most First Nations communities have health centers who hire their own nurses to do their community health as well as public health nursing. My role is to work with them in terms of understanding their role as nurses in community health.
Okay.
Community health is a specialized field of nursing, and unfortunately, it's not a well-established program in terms of training and support. So our role at FNHA is to create that support and the training so that nurses understand how to be great nurses in community.
That's amazing. So you're really working to empower that area of improvement for our healthcare system, kind of, and bridge that gap, it seems like?
Yeah, 100%. It's well known that our First Nations communities have always had their challenges in accessing healthcare. So this is one of those opportunities to try and, rather than having our community members have to travel to go access healthcare, we're bringing healthcare back to the community so that our communities have more access.
That's truly amazing, because I'm sure, being a third-year nursing student, I'm really quite novice in my understanding, but my eyes are really starting to kind of open up with how far Indigenous or First Nations people have to travel for, even if it's like a specialized, not even a specialized doctor's appointment. It could be any doctor's appointment, a dentist appointment, or anything like that. Like some of these remote communities, it seems like they could travel up to 2 to 3 days because it takes half a day to just get where they need to go. And yeah, so that's really amazing, bridging a big gap there.
Yeah, absolutely. And, just to give you some examples of that, our mothers in community have to leave community and stay in hotels for the last 2 weeks of their pregnancy to be closer to a hospital or delivering hospitals, facilities and services. So, that's just one example of, having to remove a family member from their family and their surroundings during a crucial time.
Yeah, that's a very vulnerable time.
Yeah. Another example would be, some of our communities are ferry rides, and sometimes those ferry rides don't leave and arrive on time. So if our clients are scheduled for an appointment in town, and the ferry's late, and the clients ends up being inadvertently late for their appointment, sometimes our systems have a rule, and we're familiar with it, that if you're too late for your appointment, you unfortunately have it canceled because they have to keep their schedule for the next client. So yeah, sometimes that just creates a barrier for our clients.
Definitely. Not to mention being here on the West Coast and on Vancouver Island, we have various weather fronts and everything. So ferries, it's not uncommon to have ferries cancel. So that is another huge barrier to have that happen. And just to have to reschedule, and it might be an appointment that somebody's been waiting for a really long time. Not to mention, I'm sure there's a huge financial factor to that as well. Like, are there any supports for First Nations people to have to travel to these? Like, do we have any government supports or anything like that to help them financially with travel? Or you had mentioned the last 2 weeks of a woman's pregnancy, they have to go and stay in a hotel. Like that alone, I know for myself, I wouldn't be able to go, as much as I would love to sometimes get a chance to go for a break in a hotel for 2 weeks, but obviously not in that circumstance. I mean, just to have to spend that amount of money alone, and just so the financial costs as well as the emotional costs that come with that. And sometimes Mother Nature happens, and we could be having, as women, be delivering weeks early before that. So that's a big barrier.
Yeah, absolutely. And I think that's why they chose the 2-week time frame for that. Just in case they're a little bit early.
Yeah.
You did ask about the financial piece. That hasn't always been there, but we do have a program where communities support families to get to and from services. And that's definitely helpful, but not in every circumstance is it enough. The family still is responsible to cover some of their own needs and costs to attend their appointments.
And not to mention, I guess that brings up other thoughts for me, for even being able to be aware of these services, or having the internet access or a computer to be able to outsource. Actually, in one of our first episodes with the Sound Constitution, that aired on the 25th of February, we talked about health literacy. So that's another thing. Like, I can see that there's many factors that create so many barriers to First Nations people in remote communities or in any community being able to access all of the resources that we have.
Yes, it's many, many moving parts.
Yeah. Well, thank you for speaking with us today. And I feel like just having conversations and opening up these topics and understanding the connections and how big is where we can start. So thank you very much. I can tell that you're very passionate about the work you do with the First Nations Health Authority, and specifically within the many First Nations communities up and down Vancouver Island. Where do you believe this passion and drive has been rooted from for you?
To be honest, it kind of happened by chance. I was working at Nanaimo General Hospital, and it was around the time that they were introducing the CDMR program, which kind of changed the style of nursing that I had been trained for. And I was ready for a change. I remember talking with a friend of mine who I met at lacrosse. Our sons both played lacrosse. And she had mentioned that her community was looking for a nurse. And I had no idea about community health nursing up until that point. Okay. And I will admit, at the time, just hearing the description of the work had turned it down. I thought that at that time in my career that I was focused on acute care, and that, that's where I was going to be able to make the biggest impact. And for me personally, I couldn't have been more wrong. I eventually did say yes, and I did start working for her community, and realized that was where I needed to be. In hospital, it's nice to be able to support people in their acuteness of their illness. and give them the information to be able to go home and you hope that you've provided them with enough information to support their healing at home once they've left. The reality is for me was when I got into community health nursing is it gave me the extra space to be able to really sit with people and talk about what got them to their phase of their disease or their illness or level of health. And the time and space to be able to sit with them with that, as well as plan for how are we going to undo this?
Yeah.
And, it's just easier to get them motivated and to see them get interested in their health. And so, I have to say that, just kind of having that happen in front of me and, unplanned was probably the best way.
It's amazing, really inspirational. And actually that brings me to a thought on this semester we've been learning with our global health, learning about upstream and downstream approaches to health. And it really kind of clicked with me that being in the acute care setting, we are kind of taking more of a downstream approach, which is definitely necessary. But it's almost kind of like trying to put out all of these fires without really understanding where the root or the source of the fire is coming from. And what I'm hearing from what you are doing in the communities is more of an upstream approach in the sense of really trying to kind of get down to the root of individuals and understanding where they're at and coming to know where they're at with their health and empowering them. So, and thank you. It's empowering me hearing you speak. So
thank you. No, and it's very true. And I don't think we really grasp that. I know they teach that to us, and I still remember it quite vividly. The training on how to identify individual problems, familial problems, community, and how they all sort of intertwine. I don't know if you're at that phase yet. But if you learn that in school and then you're set into an acute care setting, I know we're supposed to keep this in the back of our mind of talk to our clients about, what does your family look like? What does your community look like? What access to resources and services do you have near you that might help you during your healing journey? Unfortunately, just because of the constraints of the acute care settings, everything is such a quick turnaround that often falls by the wayside. So community health is where that kind of you get to pick that up a bit more. It was quite exciting to be able to sit down with that and be like, I knew I learned that for a reason.
Yes. You just spoke to something that kind of triggered something a little bit for me with how we are taught about how everything's interlinked and how it's important to understand and come to know the client and their family and where they're at with their health. But in a sense that in the acute care setting, I guess the culture of that almost is high paced. And I think it also correlates to a level of workload that's put onto nurses and I think their available resources to be able to spend that time. And I can really see how it's like two entities that really affect each other. And it's like we have to kind of get out of this cycle somehow. And I thank you for doing what you're doing, because I feel like you're bridging that and us having this conversation is doing the same thing. So it's exciting.
Thank you.
Yeah. For those of you just tuning in, my name is Cassandra, your host for today, alongside with Karla, my co-pilot. We're third-year BSN nursing students here at VIU on a sound constitution with CHLY 101.7 FM. We are sitting down today with special guest Michelle Prince. Michelle's a registered nurse working as a community health practice consultant for the First Nations Health Authority up and down Vancouver Island. In this episode, we're starting to open up a conversation surrounding Indigenous people and the inequities they're still facing today. This is a conversation we all need to have more often. and start taking action against systemic racism and discrimination Indigenous people in our communities and across Canada face every day. So thank you for tuning in to A Sound Constitution on CHLY 101.7 FM. Let's jump right back into this conversation. If you feel comfortable, Michelle, I'd like to ask you very personal questions, and you have no obligation to answering it. But growing up on the island, and actually going through, like we had mentioned earlier, the nursing program here at VIU, which has led you to become the grassroots healthcare professional you are today. Can you share some experiences growing up as an Indigenous woman here on the island?
Yeah, no, I would love to. Yeah, it's been an interesting journey. And yeah, I guess I can start at the very beginning of my childhood. I grew up with my father, who was a French Canadian, and I'm quite fair-skinned. And it was interesting that it wasn't till the day of graduation when I'm filling out the paperwork and it asked whether or not I identified as an Indigenous person, and I checked the box that I was, and my best friend noted and was quite surprised that I had done that. And that was pretty much the first time that I realized that the people around me didn't quite realize that I was First Nations, that even I knew it, but I didn't also identify with what it was other than just knowing it. From there, I think the next phase of my journey of understanding what it was to be a First Nations person was definitely in nursing school. And it was part of the experiences of what I was seeing in hospital, and understanding there was definitely a difference with the care. And yeah, this is just my own personal observation of what I was witnessing. And then that connection I had with the First Nations people in care. I felt connected to them, and I'd want to go into their rooms and say hi to them, and just, even though they weren't my clients, just kind of pop in and just give them look them in the eye and just like make them feel like they were noticed. And it made me want to become a better nurse for everyone, really, at that point, because and I can't say it was just First Nations people. It was the level of care changed drastically with different types of people, people with mental health issues, people with addiction issues. And yeah, so it just, I was acutely aware that, I wanted to be a nurse to everybody.
Oh, amazing. Yeah, thank you for sharing that. Really brings up that we are one, we are humans, and there's no space for segregation or discrimination because of judgments. And I know for myself, even going through the nursing program, and I feel really lucky and privileged that I've been able to be vulnerable enough with myself to understand that even me being an Indigenous individual, understanding that I had my own judgments as well and stereotypes just because of systemic upbringing, how kind of society shaped me as an individual and the environment that I was in, because I myself didn't grow up in a Indigenous community either. There was very few First Nations individuals in my school, and it's only because I've been able to reflect on that myself is that I now am able to understand the amount of racism that I experienced as an individual. And I'm still unpacking it. Like, I still don't quite understand. But things like I never really thought twice going in class. And because my parents checked that I was First Nations in my school registration in elementary school, they had programs for me for cultural training. I never really understood why I was getting removed from my class various points throughout the week for an hour or two and put into a room and given a book and just kind of left by myself. And now that I've been able to understand and unpack some of my personal experiences and judgments and kind of like what I know to be the world around me and to see systemic racism, that that in itself is a level of segregation, of dividing us, when really we need to be coming together. And especially times like now with the pandemic, and I think moments of tragedy makes us really reflect on how we need to stick together. Yeah, I really appreciate us having this conversation, and even listening to you and being able to speak to what I know. It brings up even more in-depth knowledge and awareness. Mm-hmm. Even as I sit here, I think that, oh, well, I've got all this interview prepared. I'm like all ready, and just having this conversation, I'm like learning more and about myself. And I think more of these conversations need to happen. And I know it can be challenging and uncomfortable, but I feel like we've got a safe place here, and I think it's a really amazing opportunity. So again, I thank you.
No, this is great. I appreciate this. This helps me as well.
So now maybe a similar question, but directed towards the work you are doing within the First Nations communities you're working in. Can you speak to your experiences as a registered nurse working in these communities in the First Nations Health Authority, and what barriers you see within the work that you're doing?
Yeah, absolutely. And yeah, I think that's been a learning journey all in itself. Mm-hmm. We're taught in school that access to services and healthcare appears to be really easy. Mm-hmm. That it's right there with, you can go to your local GP, you can go to emergency care centers, or you can go to the emergency room. Mm-hmm. But through my experience of working in the various healthcare centers up and down the island, it's not exactly true. I gave you 2 examples earlier of what would seem easy for someone to say, okay, we'll go to the diabetic clinic and get your diabetic ulcer on your foot looked at, would normally be, maybe a 15-minute drive. If you don't have access to a bus, it might be a half an hour bus ride for you, or if you have access to a bus, might be a half an hour bus ride for you. But a lot of our First Nations communities are quite remote, actually. I think we've only got a handful of communities that are, within city limits or like on the borders of city limits. But when you start to actually investigate what services actually go out to First Nations communities, you'll start to realize that they become far and few between. And so as healthcare professionals in the community, we try and bridge that gap. We try and highlight where those barriers are. Because First Nations communities don't typically have their own GPs, community members still have to travel outside of the reserve to go and access their doctor. Some of the barriers with that is sometimes transportation. As I said, with ferry, sometimes people might not have their own vehicles, and so getting themselves even to their doctor's appointment might end up being late. And I don't know if it's still the rule, but I remember when I first got out to community health nursing, doctors would drop clients for too many missed appointments. And
I don't even know what to say to that. Wow.
And it's not something that's well known.
I did not know that.
Yeah, a lot of people don't know this, and it's not just doctors. It's dentists, it's physiotherapists, it's any sort of access who tend to work on a system of appointments. And you can't blame them. No. Everyone needs to be organized in their day. And we're not faulting that. But at the same time, I would love for there to be just a little bit more understanding of when a client doesn't show up. To ask the question, to take the time to ask the question, okay, you weren't at your appointment. Was there anything that you needed to get there? And 9 times out of the 10, you will hear the story of how hard they tried to get to that appointment. Because I guarantee you, I sit with these clients on a regular basis, not so much anymore in my role right now, but when I was working as the community health nurse, just that look of almost desperation in their eyes of saying, I wanted that appointment. I can't afford to wait another 2 weeks to get in to see that doctor, or to have them realize they're not going to take me. They're not going to look at me anymore. Where do I go now?
Wow. That just gave me goosebumps in the sense of really seeing how, from one systematic point of view of understanding that a clinic needs to have organization, and because they are all basically firing on all cylinders and things, but how easy it is for their perspective to get lost on why an individual missed an appointment. And it brings me back to just being able to have that conversation and open up that conversation and be able to try to bridge that. And another thing that brought up for me is the individual experiencing those barriers, what ripple effect that is causing in their life, whether it's just thinking about that for myself and trying to put myself in that individual's shoes brings up anxiety for me. And living in that fight or flight stage constantly and having it's like there's just all of these layers, like these sandbags of layers being put on top of you, and that's just one little scenario. And I feel like that is also another reason why it's hard to have these conversations, because these conversations have to get down to the foundational part, and that takes time. And it takes time to be able to make sure that the perspectives are getting understood. And so them having those barriers, just thinking about a health aspect, what health issues are going to be bringing on top of that. Now they've got to find another appointment, and if it was a time sensitive thing, they needed a prescription refilled or something, like the amount of, it's endless, the amount of ripple effects that is causing.
Absolutely. It's prolonged illness and disease. It's a continuation of the decrease of quality of life, and how, and a part of that is, if you went to, and we're going to use a completely different scenario. If you went to a store and you didn't get the service that you knew that you should have gotten, your first instinct is to be upset with that and share your experience, not to say that the whole company that person worked for is horrible and they don't know how to treat people, or they don't know what's going on. But even just that effect of sharing that story with your close family and friends, how that might impact their feeling towards going to the same place. And so when that person or those people get sick and they feel like that's the only place they need to go to, it's going to create a little bit of hesitancy and an unwillingness, because what if they're late? It's like the trust is gone in some levels, even if it's just a sliver of it. And so it creates like a consciousness barrier, basically, of maybe not reaching out to a doctor or a healthcare professional and just putting it off because they don't want to deal with the hassle. Or thank you again for sharing this conversation. And actually, just going back to that analogy of going to the store and that those two individuals having an interaction that elicited some type of emotional response, I think again it kind of brings me back to being able to be vulnerable enough to have those conversations, because that store owner, there was obviously his own perspective of something that was going on for him that the person coming in there purchasing didn't know, because they're in their own scenario and their own awareness. And I think that just brings me back to how I think we're going to, as communities and as individuals and as Indigenous people and non-Indigenous people, how we're going to be able to move forward together in the most positive direction, and is by being able to be one and work together and work through those challenges and have those hard conversations and understand each other's perspectives so that we can move forward. And I guess it's just figuring out how to work together and how to take that really first hard step. And it looks different in every situation. So absolutely. And I think that's definitely good to point that out. And I would agree with that point, is, having to have that conversation on on an individual basis. But also having that conversation within ourselves. How do I show up? And, what may seem normal to me in my world, in my house, with my friends, might not always seem normal to how my interactions with you might be. And so I think we have to look at ourselves in the mirror a little bit, and on both sides.
Definitely.
But after that next step has to be, how do we have conversations with each other to be able to ask? There's a quote that I've always kind of carried with me, and I don't know who it's from, but it's, you don't know what everyone else is going through. So just be nice, because it could be the worst day that they're having and they're trying to just put a smile on their face, or, so be nice to people. You just never know.
Yeah. And we all have our own story. And I think being in the nursing program, I thought I had a good idea before, but being in the nursing program, I learned about phenomenology. I think that term comes to mind for me when just having this conversation, is that we all have our own lived experiences, and we all have our own footprint of what we understand the world to be. And I think being able to understand that each one of us has that very unique footprint, we can be non-judgmental and be curious about other people's perspectives, because I feel like in any situation we can take that situation and learn from it.
Absolutely. I was just trying to look for a quote, no, it's not even a quote. It's part of our nursing training.
Yeah, okay.
And I was just trying to remember the exact terminology of it, and I'm not going to remember it at this point. The concept is looking at our own judgments and ensuring that we're not bringing that into the work that we do. And I think we have a lot of work to do with that, because just looking at the systems and understanding that, we have a lot of people who are, suffering from addictions and mental health, as well as Indigenous, the racism for our Indigenous people. It almost makes me wonder why that is, especially in our acute care setting, because I believe that we were taught not to bring judgment into our care since day one of our program, pretty much. And how do we enforce that? Yes. How is this being allowed when that was part of, our basic training of, do no harm, do your nursing care without judgment. I remember one scenario was, if you had a rapist in your bed and how do you care for them? And you either remove yourself completely if you can't give them the care as well as you need to, or you just understand that you have to treat that person the same as you would an 80-year-old elderly woman that, you would wish no harm upon. So, I think we have to take a good hard look at ourselves and our practice as well.
Definitely. And that brings up for me, kind of what the culture is in the healthcare system and down to the individual units and the individuals working within those units. What's the kind of the culture and specifically in regards to how First Nations people are being treated. I feel like maybe, for instance, if I didn't have a good enough foundation of being able to name what just happened, if I saw something racist going on that I felt uncomfortable with, if I didn't have the confidence to be able to do that, and I let it slip one time, I feel like then it's like I am slowly getting sucked into the vortex of what that cultural belief is in that medical unit. And I feel like that's kind of the slippery slope, is that it looks too daunting and scary to be able to have that direct conversation and name it how it is. And I question if maybe that's why it's so hard to change. It's like it's Titanic. It takes a really long time for a big ship to change. And that big ship is our systems and our institutions and what's being taught and what the culture is and what the belief is in that entity. So yeah, I think it is about, I think we've said it multiple times already, is having these conversations and being able to be vulnerable enough and being able to personally reflect, I think. And that's one thing I've really learned about is personal learning reflections. And first year, I have to say, I was kind of like, well, what is the point of this? I know what I am and I know what I believe. And that was just a naive thing of me to think that way, because that's evolved now into really being like, wow, I'm so grateful for that, because it's first teaches me why I have emotions or things that come up. So that's really amazing. For those of you just tuning in, my name is Cassandra, your host for today, alongside with Karla, my co-pilot. We're third-year BSN nursing students here at VIU on a sound constitution with CHLY 101.7 FM. We are sitting down today with special guest Michelle Prince. Michelle's a registered nurse working as a community health practice consultant for the First Nations Health Authority up and down Vancouver Island. In this episode, we're starting to open up a conversation surrounding Indigenous people and the inequities they're still facing today. This is a conversation we all need to have more often and start taking action against systemic racism and discrimination Indigenous people in our communities and across Canada face every day. So thank you for tuning in to A Sound Constitution on CHLY 101.7 FM. Let's jump right back into this conversation. And Michelle, just as we start to bring this interview to a close, something that comes up for me in our conversation here is that what we've been talking about is having a conversation and reflecting, and how we really need to come together and stand as one to make a change and grow from where we are now and create bridges that gap our barrier in our systems and within our communities for how Indigenous people are viewed. Specifically, what we've been talking about this evening is in the healthcare system. And one thing that comes to mind is how this pandemic's really exposed that. I guess you could say one positive thing that's come out of this is that we've really recognized where we are as a community and what barriers we have and what gaps we need to close. And I think that's really been illuminated with this pandemic. For myself, I'm finding a positive out of, and not a positive out of the pandemic, because it's challenging, something we've never had to face. But I guess what I'm trying to find gratitude and positivity out of is that we're given an opportunity to learn from this and to come together and eliminate the inequities. And actually, maybe eliminate is not a right word, because that's like pretending it didn't happen. But maybe being able to just move forward and support each other in the way that we need to be supported on an equal ground as a humanity, as a community, as an individual.
Just to take that a little bit step further, in looking for that gratitude piece, there absolutely is lots to be grateful for in terms of seeing these things addressed and developing that understanding. The one thing that this COVID pandemic has done for us is it's created a better partnership between our First Nations communities and Island Health in terms of services. And I think one thing I should highlight is, we have had Island Health staff come out to our communities to offer testing and screenings and whatnot. And I believe that experience gets to be taken back to their organizations, and they get to have these great learning opportunities to say what seems so easy actually is not so easy. And so, it's been fun to sit at these tables with Island Health and really have them, listen with open ears and realize, yeah, okay, we saw it firsthand. So, we understand that is an absolute challenge, that is barrier. How can we address this? So we are seeing we're being able to have those conversations and these barriers are being addressed. And it's not just happening on a whim. These conversations we've been having at a provincial level or at least a regional level for about a few months now anyways. So it's nice that we're at least having the conversation to look for solutions. And that's exciting. Like you said, it's, trying to turn a big ship in the water as it's going doesn't happen overnight. Yeah. And we're all aware of that. And I don't think we are looking for quick solutions. Yeah. We're looking for long-term solutions that are effective. Nobody's in a hurry right now. Yeah. And I think having the conversation at first, when somebody first says something went wrong, your initial reaction is to be like, oh God, you almost have a knee-jerk reaction to either it didn't happen like that, or it did happen and we got to put that fire out right away. To now we understand that when somebody says something happened and it didn't happen right, okay, tell me your story. Yes. And I think that, that's having a really good impact because people want to understand. More people want to understand, and now we just hope that catches fire, and that more people have these conversations about what they're learning.
What I'm seeing is it's really exciting because it does feel like in the last few months we are getting more traction than I think we've ever had in our history of trying to come together as one and recognize the barriers that First Nations and Indigenous people are facing today. And that brings up a thought actually for me is that when you're speaking to Vancouver Island health authorities coming into remote communities doing testing and them having their own personal experiences and bringing it back to and conversations starting to happen, what came up for me was that kind of knowledge can't be taught in a textbook. And I feel like this is probably why change is so hard, because something like that you can't just learn by making a project or reading an article and having to do a paper on it. Like there's nothing, you can't learn that by somebody else just telling you that is a situation. And I feel like being able to go in and that's where we are going to get our most traction in being able to change is by living it and seeing those experiences and being alongside these communities and individuals that are experiencing these hardships. And then I feel like we're going to be able to feel that because we can see it. And then, I feel like I'm really excited for myself to be going into the health profession because I feel like I have a voice, and I think every one of us have a voice, and every one of us have a really unique history to bring to the table, and every one of those situations and conversations, it's exciting because we can take learning experiences from anything, even those when you're speaking to something went wrong. I feel like you're speaking to it is a knee-jerk reaction to, I think, be defensive over it. And one thing I'm really learning within this program is that when something does go wrong, it's almost exciting. It's like, okay, well, why didn't it go wrong? Like whatever is happening in that situation, it's providing us an opportunity to do things better and grow and evolve. And that is really exciting. And I feel like it's endless opportunities of growth for anyone, because if you can let go of that knee-jerk reaction and be vulnerable and be able to reflect and be open and have those hard conversations and be able to state that you're uncomfortable and name it, I think it's endless opportunity for growth. And it's exciting for me personally, and to be able to see it in our community it's very, very interesting.
Definitely. And I'll just add one thing to that. I think is continue to have that conversation. Because to have a conversation with somebody about a topic one time, it's like watching a movie 3 or 4 times. Each time you watch it, you learn something different that you missed the first time you watched it. So being able to continue to have these conversations with somebody, each time you do, you will grow, because the focus won't be on something you already covered that you've learned. It'll now be on the next level of what you could learn. This is fantastic, and I appreciate that you're doing this.
Yeah, I thank you so much for taking the time tonight to speak with me, and I feel like what we're doing is gaining traction in itself, and I hope this conversation and interview finds you well and finds our listeners well, and again, I thank you. Before we finish things off, is there anything else you'd like to share with our listeners today, Michelle?
No, other than just saying thank you. Being curious is an important part of being human, and an even more important part of being a health practitioner. We're trained to know how to solve problems, but sometimes we can get ahead of ourselves. And so, just never lose the opportunity to continue to be curious.
Thank you.
Thank you.
Look forward to doing this again.
Okay.
We've come to the end of part 1 of our episode related to Indigenous health, where we shine a light on some of the systemic racism found within our present-day BC healthcare system. Thank you to our special guest today, Michelle Prince, who is a respected RN working for the First Nations Health Authority here in Nanaimo, BC, and to our host, Cassandra, who is a third-year BSN student at VIU. We thank the elders who have inspired us and brought us strength along the way, and ask for their continued blessings and wisdom as we move forward together to create a brighter future. As we close, we at A Sound Constitution and VIU would like to answer the calls put forward by the Truth and Reconciliation Commission. We respect and uphold call number 22, where those who can effect change within the Canadian healthcare system must recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. We add our voices to call number 23. All levels of government must increase the number of Aboriginal professionals working in the healthcare field, ensure retention of Aboriginal healthcare providers in Aboriginal communities, and provide cultural competency training for all healthcare professionals. And finally, as part of number 24, we call upon medical and nursing schools in Canada to require all students to take a course dealing with Aboriginal health issues, including the history and legacy of residential schools, the United Nations Declaration on the Rights of Indigenous Peoples Treaties and Aboriginal Rights, and Indigenous teachings and practices. We thank you, our listeners, for taking the time to consider carefully the content presented in our show. We welcome your feedback and look forward to demystifying health concerns that are of interest for you. Please email us at asoundconstitution@gmail.com with your suggestions. Please join us on Thursdays at 2 p.m. for new episodes of our show on CHLY 101.7 FM. My name is Karla. Have a great day.